Good day, this is Dimitri Lascaris coming to you from Montreal, Canada for Reason to Resist on July 18th, 2026. From the time that Israel's genocide began in late 2023, Israel's military has waged an unrelenting, pitiless war on the healthcare system in the Palestinian occupied territories. Israel has destroyed or damaged dozens of hospitals. Since the beginning of this year, 2026, in fact, Israel has attacked 22 hospitals in Gaza. That's just in the past 7 months. And here you can see a report to that effect in the Vatican News. On top of all of that, Israel has expelled the United Nations Relief Works Agency from Gaza, where the UN agency played a critically important role in delivering healthcare to Palestinian refugees. Israel has bombed Palestinian ambulances and gunned down Palestinian emergency workers. Israel has deprived Gazans of essential medicines, including anesthetics required for amputations, even on children. And Israel has imprisoned and tortured Palestinian healthcare workers. Perhaps no other imprisoned Palestinian healthcare worker has captured so much attention around the world as Dr. Hussam Abu Safia. Recently, during a brief court appearance in the genocidal entity, the world caught a glimpse of how months in Israel's torture dungeons have weakened this famous and extraordinarily courageous doctor. And there you can see a photo of him up on the screen on the left, taken while he was in detention during that court hearing. And on the right, you can see the good doctor in healthier conditions before his imprisonment. Now here to discuss these crimes with us is Dr. Karameh Hawash-Kuemmerle, a Palestinian physician who co-founded Doctors Against Genocide, and she's joining us today from Boston in the United States. Thank you very much for coming onto our program, Doctor.
Thank you so much, Dimitri. Thank you for inviting me, and thank you for your relentless advocacy for justice.
Thank you. Before we begin, I just want to remind our audience, Doctor, that if they find this video to be informative, please like and share it, and please do subscribe if you're not already a subscriber. Help us to expand the reach of our unapologetic, on-the-ground resistance journalism. So, Doctor, could you please begin by telling us more about the imprisonment of Dr. Abu Safia? In what conditions, to the best of your knowledge, is he being held?
Of course. Dr. Hussam Abu Safia is, I think he's 52, and he's a pediatrician, and he is the director of the pediatric department at Kamal Adwan Hospital, which is a pediatrics hospital. It's in the north of Gaza. And I personally got to know him through my work with Doctors Against Genocide. We heard that Dr. Hussam was surrounded by tanks in Kamal Adwan Hospital in 2024. The hospital was the only hospital serving children. It was filled with patients, especially children, who were injured and who were very sick. And Dr. Abu Safia used everything that he could to raise awareness about the hospital and to appeal to humanity at large to prevent shutting the hospital, attacking the hospital, evacuating the hospital. So we heard from him, we heard from his colleagues, and we actually started having almost daily phone calls with Dr. Hussam, giving us updates about what is happening in the hospital. While he was surrounded at the hospital, his son, his 14-year-old son, was killed right in front of the hospital by the Israelis. And this attack was only used as a measure to pressure and to scare and to frighten these doctors and their patients to evacuate. But the reality is, evacuation in Gaza is not that there is a fleet of ambulances waiting for your patients to be transported to another hospital. It's pretty much evacuation into the bombed streets and the neighborhoods. It's deadly. It has always been deadly. Our colleagues have been losing their patients. They have been losing their fights because of these repeated attacks on the hospitals and repeated orders of deadly evacuations. When we first met him, we at our end tried everything to raise awareness, to advocate, to demand that the hospital remains in working. And to the degree we actually wrote a letter to President Trump. And myself and Dr. Jbour, the other co-founder of Doctors Against Genocide, to the degree that Dr. Hussam himself recorded a short message appealing to the humanity of President Trump, telling that he's a pediatrician, he has kids in the hospital. What's he going to do with them? If he evacuates or if he leaves the hospital, these children will die. At some point in December, the siege on the hospital became so scary. The tanks were advancing into the hospital one by one. So the hospital was surrounded by destruction. It was itself bombed. Imagine that the tanks were surrounding it. And he left the hospital to speak to the person in charge from the Israeli military. And witnesses said that he thought he will reason with this man, that he will, if he listens to him, he will believe, he will move him to protect the children and to protect the hospital. Instead, he was detained violently. And we have not seen him free since. And it has been extremely difficult to communicate with him. It has been very difficult to get updates on his case. Recently, Physicians for Human Rights Israel have been sending their lawyers to meet with him. And we started getting some updates. Unfortunately, the updates are extremely horrific. So we have been hearing about him losing weight, losing like almost 40 kilograms, and he's not an overweight person. It's like everyone in Israeli detention loses half of their body weight. He has been exposed to violence. He has been beaten with a metal hammer, with metal rods. His ribs were fractured. We think he had a brain injury because the last time his lawyer met with him, from a physician from Human Rights Israel, only a few days ago, he was in and out of consciousness. So as if, his mental status was constantly altered. And as a neurologist, I know this is a sign of traumatic brain injury or, severe concussion or even intracranial bleed. Unfortunately, he is not getting medical care. We are not getting any information about his medical situation other than what his lawyers is reporting. And the Israeli Supreme Court wanted the military to give an update on him, and they refused. They said he's fine, he's getting medical care, there's nothing to worry about. While we have seen his pictures with bruises all over his body. So it is an extremely concerning situation for us as a medical community to see one of us being tortured and being denied medical care for simply trying to do what we all do, taking care of our patients.
May I just go back to what you said a moment ago about writing a letter to the president?
Yeah.
Did you and your colleague receive any response at all from the White House?
No, not at all. And the letter was sent to him. I think it was delivered to him by hand by somebody from, who has contacts in the White House. And we have not heard anything. We have been visiting the Congress and the Senate repeatedly, almost every month, as a group of medical professionals, advocating for his release and demanding from our elected officials to actually abide by American law and American prohibition on torture.
Mhm.
It is absolutely unlawful in international law and in American law to torture anyone.
And what happened to the hospital at which Dr. Abu Safia worked following his arrest by the genocide forces of Israel?
The hospital is almost entirely destroyed. The equipment are destroyed. The building itself is collapsing. The hospital still has doctors and nurses somewhere in whatever they could save, because there are people in the north who still need care. And we have learned from our colleagues in Gaza that they never let anyone behind, and they always follow their oath, even in genocidal conditions. They are still trying to open it. We're still trying to help them. The hospital is in a very dangerous zone. It's very close to the yellow line. And yellow line means that, anyone can get killed close to that place. But they still have to do something to help patients.
Mm-hmm. And you mentioned the organization Physicians for Human Rights Israel, which has gone so far as to accuse Israel with complete justification of committing genocide. But how do you assess the overall reaction of the Israeli medical profession, not just this particular honorable group of doctors, but the overall performance of the Israeli medical profession in terms of responding to the genocide being carried out by its government?
Shockingly silent and shockingly complicit.
Mm-hmm.
We do not, we do not have contact with Israeli doctors because, we know what the polls are saying. We know what there was a letter by hundreds of Israeli doctors to their government justifying bombing hospitals, which is an absolute crime against humanity.
Mm-hmm.
We're pleasantly surprised by Physicians for Human Rights. We feel that they are working, doing very good work. There are several Palestinians in the organizations who live in the border in 48 areas. And they have been driving the campaign, and they have been trying to visit Dr. Hussam and his lawyers and all that. But at least there is this contact that through which we're able to get some information, and through which the family of Dr. Hussam Abu Safia is also able to get some information about their beloved father and husband and brother.
Mm-hmm. Now, what can you tell us about other Palestinian healthcare workers who are currently imprisoned in these torture dungeons?
Thank you for asking. And this has been a little bit of a sensitive issue for the doctors in Gaza, because Dr. Hussam Abu Safia is not alone. There are at least 16 other doctors. There are 2 doctors who have been murdered and whose bodies have not been returned to their families in order to bury them. There are at least another 80 to 100 healthcare workers who are detained. What we are hearing from our colleagues who are in the medical profession who have been released is that the healthcare workers are subjected to an extra amount of torture, and they are not allowed to give medical advice to the other prisoners. They are really targeted. with an additional level of torture, isolation, solitary confinement, and all these horrible things.
How would you assess the state of the healthcare system in Gaza today? I mean, are there any hospitals that are fully functional? If so, how many? And what is the general state of the healthcare system, not just in Gaza, but also if you could talk to us about the state of the healthcare system in the occupied West Bank?
So we're in close touch with medical doctors in Gaza. So every single hospital, 36 hospitals, has been destroyed at some level. Many of them are rendered not functional. The hospitals that are somewhat functional, Nasser Medical Complex, somewhat functional, but there is lack of medications, lack of equipment, lack of imaging facilities, not consistent supply of anesthesia, not consistent supplies of IV fluids, or even baby formula that is needed for babies who are premature. So these hospitals, Kamal Adwan, Shifa Hospital is somewhat open, but it's largely destroyed. Al Auda Hospital, Shuhada Al Aqsa. So there are hospitals that are partially destroyed that are still working. They're still open to see patients. The main challenge is the almost zero stock of medications. And it happens very, very frequently that the fuel is not allowed into Gaza. So the generators do not work. The Israelis are not allowing solar panels. Solar panels have always been something that the people in Gaza, and especially the hospitals, used for energy, because there has been a siege on Gaza for over 17 years. The Israelis are not letting solar panels in. They're not letting generators. I know from Nasser Hospital, they have 2 generators that have been running nonstop for the past almost 3 years, and they have worn out. So by a miracle, they're still working, but they break, and then they have to fix them again, and they have to wait for the fuel to enter. It's really practicing medicine under genocide.
Mm-hmm. And in the West Bank?
The West Bank is another story, and we don't talk enough about the West Bank, even though the West Bank is going through a tremendous a period of tremendous abuse and horror. The Israelis take the taxes from the people in the West Bank, and for the past 1 year or so, they have not been letting the taxes go to the Palestinian Authority. So the Palestinian Authority is broke. The medical professionals in the hospitals have not gotten paid for over 24 months. So the hospitals are working on nothing. The stock of the medications is close to zero in almost every single medicine. So the attack on healthcare is extreme in the West Bank, and the doctors are depressed. They just do not know what to do. The elective surgeries are not being done because there is no money to pay for the medications, and there is no medical supply. So urgent things are being done. Some elective, every now and then they can be done. A lot of people are running out of their diabetes medications, hypertension medications. Everyone's very sick. I mean, I was there less than 10 days ago. And just walking in the streets and seeing people, I can see sick children. Children are very thin. I have never seen anything like this. My own family members who are my age look like they are 50 years older than me. And they're all no medicine. They can hardly be able to go to a doctor. It's insanely bad.
Mm-hmm. Mm-hmm.
And this is healthcare. Education is very much the same too. Schools.
The last thing I'd like to talk to you about today, Doctor, to close out our sobering conversation, is the state of the medical profession in the United States. Where I currently am in Canada, I've seen a lot of doctors, not a lot, but some quite outspoken physicians who are plainly supporters of Israel, fanatically so, claim that in the medical profession in Canada, there is rampant anti-Semitism. And I've seen doctors make similar claims in the United States that there's rampant anti-Semitism within the medical profession. Nobody really seems interested in talking about the existence in the medical profession in the United States and Canada of anti-Palestinian racism. Do you believe there is widespread anti-Palestinian racism in the U.S. medical profession? Have you seen evidence of this yourself? Have you been on the receiving end of it yourself?
I think it's worse than just racism. It's like this deliberate silencing of anyone who talks about the conditions under which the Palestinians live, the conditions, without even going into the root causes. Mm-hmm. So there is this wall that is erected in front of anyone who wants to speak or say something about what is happening in Palestine. And it's especially painful because in the US, we are paying taxes to do this. So we are responsible. We're responsible to send the weapons that kill children in their tents and in their hospital. We are also responsible for providing the political will and protecting the Israeli government, protecting the Israeli government, allowing the Israeli government to do this and get away with it. How many vetoes did the US give to prevent a ceasefire in the past 3 years? I think like 4 or 5. And instead of helping those that are being killed by our own weapons, we are punishing the Palestinians. Visas are not allowed for patients to get care by hospitals who are willing to see these kids. Students are not allowed. It's really, really insulting, and it's very inhumane. So it goes beyond just mild racism. This is the kind of racism that actually is lethal. Mm-hmm. So I'm very disappointed.
Mm-hmm. One thing that I would add to your litany of reasons for U.S. Culpability is the fact that over 23,000 U.S. citizens serve in the Israeli military as it is carrying out a genocide. So it would be difficult to overstate the extent of U.S. responsibility for this horror, unending horror. And finally, Doctor, before I let you go, could you tell us how we can support people who are listening to our conversation today, can support the work of Doctors Against Genocide?
Thank you so much, Dimitri, for giving me the time. Our organization is very active. We have weekly webinars every Sunday. If you go to our website, doctorsagainstgenocide.org, you can sign up to the weekly webinar where we get weekly updates about what is happening in Gaza, the West Bank, Sudan, Congo, Tigray, or Rohingya. We cover every community that suffers from a genocide. We cover these communities by educating about how genocide is a healthcare crisis. We advocate to end complicity in genocide, war crimes, and crimes against humanity. And we support communities by giving financial support to projects, to give people agency to help themselves and to help their own community. We welcome everyone to join us. We welcome our colleagues to become more involved in advocacy for human lives within the US, as we see with, how our streets became murder scenes for ICE, and beyond the US when we are responsible for providing cover for genocide and war crimes. So every medical professional is welcome, every supporter, every human, really. Thank you so much for giving me the time.
It's our pleasure. And we'll put a link to the website of Doctors Against Genocide in the description.
Appreciate it.
Thank you.
Thank you
And
so much.
thank you, Doctor. We'll be signing off today from Boston and Montreal on July 18th, 2026.
Thank you for your time.